Many men make a serious mistake when it comes to their health. They don't get regular checkups from their doctor. Some may not even have a primary care doctor. So we're going to focus on that today in honor of Men's Health Month and ahead of Father's Day with Dr. Brent Wallis from People's Health. Dr. Wallis, good morning to you. What is it about guys that they just sometimes don't always, and I admit I'm 2 months late for my annual checkup, so I don't want to be hypocritical about this.
No, I mean, it's very true. Men tend to not go to the doctor as frequently as women. In fact, there's been a couple of studies that have been conducted that show that men would actually prefer to clean the restroom instead of go see their doctor, which, there's a lot of reasons for that. I think men tend to wait until something is critical or in crisis and then address it rather than address something preventatively. So we really try to get a lot of education out there to tell them how important it is to go see their primary care physician.
When we start talking about health risks, what are the top health risks for men?
Yeah, the absolute number one risk is heart disease. Over half of adult men in the country actually have some form of heart disease, like high blood pressure or congestive heart failure or something even more severe. But we also see stroke. The thing about stroke is that about 80% of strokes are completely preventable just through lifestyle changes. And then unfortunately, in men in particular, we see a lot of problems with depression and even suicide. Men are much less likely to seek care for depression, and so it can actually progress and lead to something terrible like suicide.
Obviously, smoking is one of those things we hear a lot about, and one of those ways in which you can make a big impact on your health, and even quitting for that matter, if you've done it for decades.
Critical. It is. It's critical. We tell everyone over and over, you've got to quit smoking. Smoking's been tied to so many different types of health problems, cancers like lung cancer, which is actually on the rise in men, but other cancers as well as heart disease can be affected by smoking also.
Why do you think that's on the rise? What's going on there?
We've seen actually, you would think that men have decreased their amount of smoking, but we're really not seeing a dramatic decline. We're also seeing people live longer, which is fortunate, but as you live longer, you're more likely to develop certain types of cancer. Prostate in particular with men is very common. In fact, it's the most common type of cancer that probably 1 in 9 men will actually experience, and quite a few of those will die from it as well because they're living longer and the cancer can actually kill them.
And there is a smoking link to prostate cancer, at least some link?
Yes, smoking has been tied to practically every type of cancer. So that's why now more than ever it is really critical as we start to learn more and more how cancers develop and how to treat them. You've got to quit smoking if you are.
We always hear about get enough sleep, eat well, exercise, all that. If you had one thing to tell Dad before this Father's Day, what would it be?
Yeah, I think one of the biggest ones for me is diet. Diet is critical, and I don't think we really pay attention to what we eat very well, especially here in Louisiana. But eating foods that are high in roots really are important. They can actually help your heart health and actually reduce your cancer risk as well.
All right, Dr. Brent Wallis, we appreciate the advice. Get yourself to the doctor, Dad, if you haven't done it in a while.
I definitely will. Have a great Father's Day.
All right.